Now, let's begin the presentation. So, our first speaker is Dr. Li Zhang. And Dr. Zhang is a professor in the Department of Mechanical and Automation Engineering, and he is also a professor by courtesy in the Department of Surgery at the Chinese University of Hong Kong. He's also a director of Shenzhen Institute of Advanced Technology and the Chinese University of Hong Kong Joint Lab of Robotics and Intelligence System. Dr. Zhang's main research interests include small-scale robotics and their applications for translational biomedicine. Dr. Zhang, he will give us a talk about magnetic miniature robots for endoluminal interventions from individual to microswarms. Dr. Zhang, I will hand it over to you.
Okay, thank you, Shopen, for your nice introduction. First of all, I feel very honored that I can have such a chance to give a presentation in Science Café in China, with the theme on deploying robots in the real world. I think Amos, give a very nice, this introduction about journal Science Robotics. And, I think this topic is really the kind of, is a topic we need to think in our daily life, how we can further deploy our research results, for the real world application. And actually, it's very interesting developing medical miniature robots. As you editorial article for all of our researcher in this field. There's one interesting diagram, which I sent here related to the medical robotics. Basically, it's in a range around millimeter down to micro and nanoscale. And why we're interested in developing such kind of miniature robots is because the current tools, such as endoscopy and catheter, although they are widely used in the hospital, but they are not ideal yet for the minimally invasive intervention. Let me just use this diagram as an example. So this diagram shows a very commonly used interventional tools in the hospital. This is a tip. So usually, this is inserted in the patient body for intervention. However, the clinician need to operate, this catheter from the far end, as you can see here. And, the length can be up to 50, 60 centimeter or even longer. So for example, if you want to navigate this tip to a specific, sub-branch to reach the region of interest, then the surgeon need to twist, or do this kind of, operation in a very far end. So it actually leads some issue, for example, this kind of tool is still lack of dexterity. And another issue is the diameter. So if you want to reach a very tiny lumen, such as, those kind of tiny blood vessel in your brain, in a range about 1 to 3 millimeter, or if you want to reach, for example, the bile duct, we know the bile duct has diameter in a range about 1 to 4 millimeter. Actually, the catheter or the endoscope, they still face a lot of challenge. So that's the reason we are thinking whether we can develop, the medical micro nano robots to access those hard to reach region for the minimally invasive intervention with a design from individual agent to the collectives. Okay, so this is our research motivation, and we are more interested in using magnetic field to activate our medical miniature robots. One reason is because our human body is transparent to the magnetic field, and on the other hand, we know the magnetic field is considered safe for the human body. And, regarding the actuation, basically, there are two ways. One is you can use gradient, to create a translation. And the other approach is you can use the torque to generate a rotation. And we are interested in using, the magnetic force and the magnetic torque to actuate both in tandem. So let me continue. Perhaps my internet connection is not stable. I don't know. Let me continue. So, the idea is whether we can design both untethered or tethered, these micro robots for the medical intervention. And here we show that, you can actuate your device by either using the force, magnetic force or magnetic torque. So force can be induced when you're applying a gradient field, so the object, the ferromagnetic or the magnetized object will move from the low gradient field to the high gradient field with a translational movement. And when you apply a kind of, the magnetic torque, then, the object can be rotated accordingly if the magnetization direction of the object is misaligned with the B field. So it turns out that if you can program the B field, then basically you can create multiple degree of freedom of movement, right, of your miniature robots, including both translation and the rotation. And actually you can also well calculate, the force or the torque which are applied to the magnetic object. So this is actually a very good, thing for us. And actually, we started our design on designing the helical micro robots because this helical micro robots has been developed for almost 2 decades already. We are not the first group, so you can see that in the history, many groups have published lots of interesting results related to the helical micro robots, and people focus on the manufacturing of the micro robots in the range from micro to nano. For example, the group from ETH Zurich and the group from Max Planck Institute, right? People also demonstrate that the helical robots can penetrate through the tissue, if the applied magnetic torque is large enough. Or they also propose a usage of the helical robots in a different region, for example, in the eye, in the blood vessel, or maybe for the implants inside the ear. Okay, and actually, the first thing we are thinking is, as the, by aligning with this theme, deploying the micro robots for the real world. So, usually people propose, the usage of the micro robot deep inside the body. So the safety is a big issue, especially for those magnetic micro robots. We need to think about, right? So after treatment or after intervention, how can we deal with those magnetic material? So we are thinking that why not, we use this kind of micro robots not that deep inside of the body. So the first, thing we propose is to use it inside of the ear, actually in the region of the middle ear, for the cleaning, of the biofilm in the T-tube. So what happened is, that sometimes, the middle ear can be infected by the bacteria and induce a disease called otitis. And then, a lot of liquid can be created, inside of this middle ear region because of this bacterial infection. So what a medical doctor will do is, he or she will implant a small tube, implants called a T-tube, or sometimes people call it ear tube here, for the draining of the liquid outside this middle ear region. But the problem that because, this kind of liquid is induced by the bacterial infection, so the biofilm can grow, and after a certain time, then this T-tube can be blocked because of the biofilm growth. Then we're thinking that, how about we use a micro robot to do the cleaning of this T-tube, instead of, do a further surgery to take this T-tube out and implant a new one, because that is the current, the gold standard, what a clinician will do, right? So if this is from a blockage, then, they need to do further surgery to take it out and implant a new one, which takes 2 times of surgery. It will increase the burden of the hospital. So that's what we're thinking. Maybe we can use the micro robotic technology to solve that issue. So the idea is to use an endoscope to deploy these helical micro robots into this T-tube. And then this helical, robots can behave like a driller to break down the biofilm. Then, because of some kind of chemical reactions, they call the Fenton reaction or catalytic reaction, which can induce reactive oxygen species, which is a very strong, this kind of agent to kill the bacteria. So basically, based on this kind of mechanical and chemical reaction, we propose the usage of the helical microrobots to do the biofilm eradication in this kind of implants. And it works quite well. Because of time constraint, I will not go to details about the fabrication, but basically we're using a micro-robotic technology based on this rope coil effect, to do the batch process of these helical microrobots. And microrobots can be very well controlled, by using a rotating magnetic field. As you can see that they can do the corkscrew motion very well in the glass tube with a diameter less than 1 millimeter. And we also did some kind of fundamental understanding work to see that how well it can drill through the biofilm by using some kind of a biofilm model. So here you see the occlusion created by the biofilm, and then we use a different mode to activate this tiny driller to see that what will be the best way to penetrate through the biofilm, as you can see here with the model 1, model 2, and model 3. And we conclude that the model 3 gives you the best performance. And afterwards, after we understand everything, then we did the cadaver study. I would like to emphasize this is perhaps one of the first cadaver study by using the microrobots, okay? So which was done by surgeon at the Prince of Wales Hospital in Hong Kong. So here what you see is a cadaver head. We first implant a T-tube, so which we obtained from a patient. This T-tube has a biofilm already. Then we take it out from the patient and we implant in the cadaver head. Then we did the entire process by using our helical microrobots, by using our magnetic actuation system, and the vision was done by using an ENT endoscope. So here you can see that we can do the real-time tracking of our helical microrobots, and we can use our magnetic system to actuate it, in the T-tube for the biofilm eradication. And most importantly, after the treatment, then we can use a tiny magnet to take this magnetic helix directly out from the ear. So that means, after treatment, nothing will be left inside of your body to make sure that, the entire process is very safe, as you can see here. So this work had been published about 1 year ago in the Science Advances, which showing that, by considering the safety issue, then we are proposing the usage of, taking out the microrobot after usage. So actually, regarding the medical miniature robots for clinical relevant therapy, very recently, there's also a prospective article published in the Science. I guess many of the audience may have read this article already. Here, it basically shows that, the miniature robots, has a high potential. It's just some kind of time, issue, to deploy this kind of thing in the human body or, for the clinical trial. But of course, nowadays people are still doing a lot of work to understand more, how to well deploy the microrobots inside the body, and how to do the navigation, how to do the real-time tracking, and where will they go after treatment? For example, here show that the magnetic microrobots would be need to be biodegradable, or perhaps we need to do the clearance, right? Or take them out from the body after treatment. And of course, people in the field, we're also asking ourselves, what are the key applications about, the microrobots, their safety. And so, in the following slides, I'm going to show one way to make sure the safety can be guaranteed is, we propose the retrieval of our magnetic microrobots after treatment. Okay, so how to do that? We just show some kind of concept here. So one way is, you deploy your, for example, the helical microrobots in the body, and afterwards you take them out, right? But the previous slides we show is for the ear, but here we are just showing that, in the for the blood vessel or for the lumen inside the body, you can have some kind of design, we have some kind of, some kind of mechanical design which allow you to assemble a helical tip at the front side or at the tip of this guide wire. And what you can do that you can eject this kind of helical tip like a bullet. And after treatment, then you can you can retrieve it back, right? Because it's a helix, so you just do inverse the rotation, then basically you can then you can move it backwards. And this slide basically shows that, we can use our home designed magnetic actuation system to very good, the navigation of this kind of tethered, micro robots, which includes the guide wire and also the ejectable helical tip. And here, what you can see that we're able to eject this tip and to let it go through the tortuous lumen. And then we can also retrieve it back to guarantee that, no magnetic material will be left inside the body. And the second way is you actually can also change it to an untethered design. So, for example, very recently, we had proposed this so-called modular design of the microrobots. So what happened is this modular microrobots has two parts. One is, is with magnetic material for the actuation. And the second part is formed by a non-magnetic and fully degradable material. Here, what you can see is a kind of a cell scaffold. So we're able to use this kind of modular design microrobots to deliver this fully degradable cell scaffold to the region of interest. Then afterwards, we're able to retrieve this magnetic part back into the catheter, again, to make sure that no magnetic material will be left inside of the body, okay, to improve to further tackle this safety issue from the magnetic material. We had also done the animal study by using a rabbit model. And here, what we demonstrate is a region called bile duct. So here, what you can see is a kind of a diagram of the bile duct. The bile duct really look like the root of a plant. It has many branches, and by using the magnetic field and under the X-ray real-time tracking, we're able to do the navigation of our modular microrobots in the bile duct and deliver, this cell scaffold in the region of interest. Then afterwards, we're able to retrieve back, this magnetic part, after we deliver this functional and cell scaffold module, okay? And this work will be online very soon, in a week. So for more details, you can refer to that paper. So except for the design of those individual robots, we're also interested in a micro-robotic swarm. So basically, we know that the swarm is kind of a thing you can observe in nature. For example, a school of fish or the ant bridge, right? But in nature, we know that when this creature form a swarm, the purpose is not just for fun. It's not to form some kind of fancy pattern. It's actually to create a new function. In many cases, when they form the swarm, it can increase their adaptability to the environment, right? So their survival rate in the nature will be high. For example, after ant form the bridge, then they can cross this large gap, and a school of fish can escape from the predator, right? So this really can increase their adaptability in the nature. So actually, we are in the community, we're also thinking that a swarm or a collective of microrobots can also create a new function for the localized therapy. For example, it can increase dose capacity, or it can be easier for the for the tracking. But the problem that when we are talking about the microrobot swarm, the situation can be very different, because individual colloids or the artificial agent, how they can communicate with each other, right, is a big challenge. It's difficult to integrate, the antenna, or this kind of transmitter, or all the things in such kind of small agent. So basically, we are using kind of the interaction force, right, to form the collective, from those colloidal particles. So what happens is when you apply a magnetic field, then it will induce the magnetic interaction force from the adjacent particles. And when you actuate those kind of magnetic particle, then it will also induce the fluidic interaction, right? For example, when the particle chain keep rotating, it will form some kind of micro vortex, right, microvortex from the fluid, and adjacent, the microvortex can interact with each other. So by interplay, this kind of interaction force, then we're able to create some interesting collective behavior from those kind of artificial, this kind of tiny robotic agent, right? For example, by using the nanoparticles or other type of colloid system. So we have done a lot of work because of time constraint. To details. But basically, we have realized adaptive locomotion from the colloid particles. We're able to do the real-time tracking of those kind of particle colloids using the ultrasound Doppler mode, brightness mode, X-ray, so which allow you to do real-time tracking because we need those kind of image for the vision feedback, for the vision feedback purpose. And once you have this kind of vision feedback, and once you know how to activate those kind of particles by tuning the input magnetic parameters, you actually can also realize the intelligent navigation. Of the autonomy of microrobots, because the generation and the navigation of these microrobots can be hardly done, right, by us. So we can imagine that if you ask a medical doctor to do the navigation or performing, which was talking about the autonomy level of the medical robots. And interestingly, we found that, the main focus is still related to the surgical robots, but how about the autonomy level for the medical micro nano robots is still unclear. Okay, so then we're thinking whether we can further develop, the micro robot swarm with a different level of autonomy, by using the deep learning. So the answer is yes. So we can do that. Because of time constraint, I will not go to details. Basically, we can design our micro robots with different level of autonomy. So what happens is that what you can see is a fully manual control of our micro robot swarm. And level 4 is, with the full automation navigation of a swarm. So the difference is here, what you see is, the full automation means the swarm knows how to do the transformation by itself, and it can judge, do the path planning, make a decision by itself. And it can also judge, the destiny of the target by itself. And here, what you see the difference between the level 3 and level 4 is here. So the red point means the red point means, the destiny or, the point of interest will be judged by a medical doctor, and the rest will be done automatically by the swarm. Okay, something like that. And here, in the level 2 basically means that the swarm knows how to do the transformation and how to judge the orientation by itself. But, the path planning will be done by the medical doctor, and, the target will be also judged by the medical doctor. So basically, here what I'm saying is autonomy of the micro nano robot swarm is not something like 0 or 1. Actually, you can have, different level of autonomy. Okay, I think this will be kind of helpful, for the clinician, when they're doing intervention by using micro robot swarm. And another region, we are interested in using the micro swarm is about dark. Okay, in about dark. So again, because micro robots usually are very small, right, aging. So to deliver this with a very long distance in the body, we don't think it's a good idea. So that's the reason we think it will be helpful to use endoscope or use catheter to do the assistant job for delivery purpose. Okay. And, one region of interest will be the bile duct, as I just introduced before. And then we're thinking that, we can deliver the diagram shows the concept, right? We use endoscope, which we can, reach the region. We're very close to the entrance of the bile duct. Then after we deploy these micro robots, then they can be navigated into the bile duct for the treatment, and go inside of this bile duct for the treatment. And then another question that for the sake of safety, then we need to think the design of the micro robot, right? I mean, we're thinking perhaps, the cell or the stem cell from the patient is also a good choice, okay? So that's the reason we developed some kind of stem cell spheroid. And, here what you can see is 98% are the stem cells, only 2% are the magnetic particle, so which allow us to, quickly deploy this kind of tiny microbal swarm into the region, close to the bile duct, and then for the treatment. And this kind of cell spheroid, has a very high flexibility. It's very soft, with a stiffness similar to the brain tissue. And again, here you see that the majority of the stem cell, you just put a very small amount of the magnetic particle inside. You can have over, something like 100K or 200K stem cell. It can squeeze through, this kind of tiny channel. It has a high elasticity, and you can do the tracking of this kind of stem cell spheroid by using different image modality ranging from the endoscope, ultrasound, MRI, and also the fluorescence signal. And then, we have reported the way how to deploy these microrobots with several stages. So basically, you use the endoscope, it goes through, the natural orifice from the mouth, throat, esophagus, stomach, to the region close to the bile ducts. That's in the duodenum, right? Then we deploy the microrobots, from the endoscope. Afterwards, we use a magnetic field to deploy, these microrobots, to let it go into the bile duct. And afterwards, we switch the imaging mode from the endoscope to the ultrasound for the real-time imaging and navigation purpose. So basically, the take-home message is, by using our approach, we're able to deliver a large amount of the stem cells into the bile duct. In minutes, something like, under the real-time tracking and magnetic navigation. And another beauty of this work is actually stem cells, they have certain level of intelligence. So they can judge, which the region is they preferred, and they can show some kind of reaction to it. For example, when the stem cell spheroid reach a region with hydrophilic property, or or which the kind of biocompat kind of the region of interest, then actually those stem cells can spread out very much like a droplet can spread out at the hydrophilic surface. It's kind of wetting, and you don't need to do anything. Basically, the stem cell will judge by itself and makes the decision whether it should spread out and change from the sphere, change from the ball to a kind of a patch, right? To a kind of planar patch. Yeah, so it can be done automatically by itself. So this is a very interesting design, and we published this result in the Science Robotics about 2 years ago. Showing that we had developed a kind of microrobots swarm which can be rapidly delivered by the endoscope, and it's very safe because you are using a patient stem cell, right? It's harvested from the patient, so basically the immunoreaction can be minimized, and we had also showed the image guided magnetic navigation by using our home developed magnetic system. Okay. And this is actually close to the end of my talk. So currently we are doing the preclinical trial, the animal study in the Hong Kong Science Park. So we have a very good, operation room. And you can see here equipped with a C-arm X-ray and, the MRI and also different type of the endoscopic system. And we are working together with a clinician to see that how much we can push the frontier of the medical microrobots for the treatment. So I really would like to thank, this forum, so I can show some of our latest results. I will say that, the development of the medical microrobots is still in the very early stage, for the clinical application. I think a very important thing that we need to talk with people with different expertise. For example, here you see a photo is
we took it when Professor Ruth Taylor visited us. We know that Professor Ruth Taylor is considered as the father of the medical robotics. So, we had discussion with him, how we should further develop our medical micro robots for the clinician. And on the other hand, in this photo, what you can see here is Professor Joseph Song, and currently he's the dean of the medical school at the Nanyang Technological University in Singapore. So here showing that we're also discussing with the medical doctors to see that to figure out what are the real clinical needs. Actually, their comments and advice helped us a lot, for the development of our medical micro robots. And in the end, I also would like to thank all my group members and also the graduated, the PhD student and the postdoc. And without their help, I think I cannot show these results. And also the funding agent who provide the financial support for our research and also the support from our collaborator. That's all for my presentation. Yeah, I'm very sorry for the bad internet connection. That perhaps is one issue for those kind of this online meeting. So in-person meeting can be can have less problem. Yeah. So hopefully we can see each other in person. Yeah. Thank you.